Somebody told in one of the webinars I heard, let's say, that the heart attacks are reduced. I don't know. They say because there is a less level of stress, and as you mentioned, there is a less level of air pollution. Pollution has become less. Relatively, stress is less. People are comfortable at home, or they will fear they don't want to go to a hospital because they know they will get a COVID. We'd like to have your viewpoints.
The COVID present problem, and we know that this problem is increasing. In the West, of course, it's taken really frightening turns. We in India have been very well protected in a huge manner by the preemptive and proactive measures by our government, and we must thank them for truly saving us in a situation which could have been very bad. I mean, we're saying 15,000 patients at the moment, and think of the fact that we could be 8 lakh patients and 50,000 deaths, and we only safe at this level because of what the steps the government has taken for us. In this scenario, we're always very worried about who it can actually affect. And people keep hearing heart disease, vulnerable people, who are the vulnerable people? So I want to present 2 aspects here so that public understands. Patients with heart disease, it is not that they are more predisposed to having it, but if COVID attacks a patient who's already got heart disease, then the severity of the illness can be a lot graver, and they can be more serious, and more complications can happen, and higher death rates. That's not to frighten everyone. In fact, the prevention of COVID disease remains the same for everyone. Social distancing, physical distancing, follow the advisory at the moment of the lockdown which has been done, don't go out, wear masks, great sanitation, hygiene of hands, all that has to be followed meticulously to prevent getting COVID. Those who have heart disease have to be more particular primarily because they can be affected far more severely. And COVID, if there is heart disease, if there are blockages in the arteries and one gets a COVID infection, then one can actually have a heart attack because 2 things happen in COVID disease. One is an inflammation all across the body. The body, every artery, every organ gets inflamed because of the COVID infection as well. And then there's an increased clotting tendency of the blood, which also happens. Both of them will precipitate clot formation within the arteries of the heart, just like we were discussing how heart attack happens. And that could result in a heart attack. And therefore, immediate treatment is absolutely necessary. Then there is another subgroup of patients where COVID will directly affect the heart itself, directly, by causing inflammation of the heart muscle, which will actually result in what we call myocarditis. Myocarditis leads to decreasing heart pumping efficiency, and suddenly over a period of 7 days can actually result in low efficiency of the heart, low pump, and even a shock-like status. And a third effect of the COVID on the heart could be presence of fast heartbeats, slow heartbeats, and even death. But I want to emphasize to everybody that these happen rarely. It is not that one has to start thinking then that this is what I'm going to present with, etc. These happen in only 7 to 10% of the patients who become severe that they develop these problems. So it actually is a rare phenomenon. But protecting yourself is hugely important and very, very important. In the present era, if a patient does get a heart attack, we are absolutely able to get him to the hospital. And in a sense, because we don't know whether this is a presentation of a COVID disease, one would actually immediately give him the clot dissolving drug, like you said. And by the way, Dr. Chopra, you were a very integral part of the creation of this document itself. We were all a part of creation of the document of how these cases should be managed and this document was created by the initiative of the Cardiological Society of India. As clearly the clot dissolving drug becomes the first instance, stabilize the patient, immediately offer him the first effective treatment, do a COVID testing, wait for the COVID testing, and then take up any other elective procedures which then can be delayed, patient stabilized, and COVID testing done and taken up. So in a way, what we are saying is that cardiac patients have to be more careful, not because they're going to get COVID, but because if they get COVID, they're going to become serious. And therefore, all the precautions have to be must, but we are always there. By the way, it's a rarity that these things are going to happen. So let us not assume that every heart patient is going to suddenly deteriorate and have a problem. And we are always there to treat these situations either through teleconsults or through direct consults, whereby we can help every of our heart patients not to deteriorate during this COVID times.